As coronavirus numbers surge in Houston, the battle to save lives is increasingly uphill.
I'm calling this pulseless electrical activity for performing.
Doctors and nurses at United Memorial Medical Center tried to save a 66-year-old widow.
1, 2, 1, 2, 1, 2, 1, 2. Come on, good.
Her oxygen levels falling rapidly, her vital signs declining.
Continue compressions for over a minute and then receive without pulse. Okay?
Before she fell unconscious, she told staff she may have contracted the deadly virus from the dozens of people who gathered for her husband's recent funeral, and expressed her regrets for having such a large gathering. Despite their best efforts to revive her, she dies.
Thank you, everybody.
The other thing is that you need to understand is that in coronavirus, 1 minute you're looking great, and the next minute you are gone.
The seriously ill continue to fill up intensive care beds in the nation's biggest cities, including San Antonio and Houston, where leaders worry hospitals could be overwhelmed within days. In all, Texas has recorded close to 2,700 deaths and more than 200,000 confirmed cases of coronavirus.
We have seen an exponential increase in the number of cases that we've had of COVID. The hospital has had to expand. I mean, we started first at 46 beds, then we went to 58, now we're at 88 beds. And even though it sounds like a lot of beds, it's not enough.
Life hangs in the balance inside the hospital's coronavirus unit. Just next door to where Dr. Joseph Varone, the chief medical officer at UMMC, tried to save a life, is a patient he thinks is on the mend.
It's horrifying because you can't get your breath.
51-year-old Latanya Robinson, a nurse, thinks she caught the disease from her own son.
Some people have light symptoms, some people don't have symptoms, but those who do get the symptoms, it's like death.
Another patient, Celeste Glover, says she took every precaution to avoid getting sick.
I didn't even go to the grocery store because I have underlying health conditions. My son would go to the grocery store. Did everything in my power, and here I am.
The hospital allowed the Associated Press inside access.
We are trying to tell people, keep your safe distance, use your mask, wash your hands. They don't do it. They think this is a hoax. Anybody that thinks that this is a hoax needs to come and spend the day with me here.
To show how the pandemic is stretching resources, resilience,
she's not.
And emotions.
And I am very sorry for your loss.
Delivering heartbreaking news to coronavirus patients' families has been a constant for Dr. Varone.
That's the one thing that you don't want to do when you're a doctor. But you gotta do it. I mean, somebody has to do it.
He's worked more than 100 days straight without rest. John Moan, Associated Press, Houston.